Bring in Dr. Joel Selanikio. He's an attending physician at Georgetown Hospital. And Joel, we heard there from the governor of Washington State. They're saying they're going to make more moves to protect the elderly, specifically at elderly care facilities. What sort of measures might we see put in place?
Well, they're the kind of common sense measures that you might even devise yourself. I mean, first of all, they want to stop people from coming into the facilities that might possibly be infected. So they, I think, very sensibly have said they should cancel visits by family and relatives and friends to these facilities. Again, because you don't know whether these people who are coming to visit are in fact bringing the virus in.
Or taking it out.
Or in fact taking it out. Then, if there's already coronavirus within the facility, as there was in that facility in Washington State, potentially actually still is in that facility in Washington State, the idea is to prevent it from spreading within the facility. So obviously, you don't want to be having events, you don't want to have people eating in common areas. And I do believe that at a particular facility in Washington State where so many people have died, they have now, everyone is basically kept to their rooms, meals are being delivered individually to the rooms. And certainly one would hope that the staff is now using adequate precautions themselves as they travel between those rooms.
The cruise ship off the coast of California will dock. It's expected on Monday. We just heard about that. Thousands of passengers will be let off. That's very different than what happened with the Diamond Princess there in Japan. Is this right or wrong?
Well, you know, this is the same line, right? This is the Princess line, and the Diamond Princess is actually the same owner of this cruise ship. Everyone who looks at what happened in Japan with that ship, in which you had people who were infected and left on a ship with uninfected people without appropriate quarantine measures, by all accounts. Obviously, that was not the right thing to do. And by the time that process was over, many more people had been infected with the virus. I don't believe those people needed to have been infected by that virus. I mean, clearly, of course, if you'd taken people off the ship and put people into individual quarantines, they would not have been infected. And leaving them on the ship like that, I think, you know, people are going to be digging through that for a long time, legally and otherwise. Certainly, no one wants to repeat that. So folks need to be taken off the ship off the coast of California and put into appropriate individual quarantine.
The White House says that there will be more testing kits available starting this coming week. Do we expect to see a spike in confirmed infections?
Well, first of all, thank heavens that we're going to start to see more testing kits. I think the last time we spoke, the issue was also testing kits, and I'm frankly surprised that it hasn't been fully addressed yet, but hopefully it will be shortly. When we start testing more, we're going to find more cases, no question about it. Will that be a bump? Will it be a spike? No one's really sure. Again, as I think we'd already talked about one time, right now we're not seeing a particular rise in flu cases, for example, in the United States, which suggests that if there were undiagnosed flu-like illness, we would be picking it up with our usual surveillance. Again, this is not a perfect measure. What will be a perfect measure is when we start to test more people. So to get back to your question, we're definitely going to see an increase. And the question is it going to be a small one, medium, or a very large one?
Dr. Anthony Fauci, we heard from him there in Toby's report. He's one of the top infectious disease people here in Washington at the federal level. He explained that there should be antiviral drugs available in about 6 to 8 weeks, and that's different than a vaccine. Can you explain?
Well, so of course a vaccine is something that's designed to stop you from becoming sick, from getting infected in the first place. And the fact is, before this coronavirus came out, of course, we didn't have any potential vaccines against it. Those vaccines have to be made for this particular virus. With the drugs that are used to treat people who have coronavirus, it's a different story because we have lots of antiviral drugs, some of which were developed for the previous SARS and MERS epidemics. And those are, you know, basically designed against similar viruses. So people think, I think quite sensibly, let's go ahead and test these drugs that we already have that have already been tested, at least partially in humans, so we're a little bit less concerned about the safety. Let's find out whether they're actually effective. Again, with the coronavirus vaccine, what you're looking at is basically developing the vaccine, then doing safety testing, then efficacy testing, or basically testing both of those things. Whereas with these drugs, you've already done part of that work to begin with. So I would expect, well, actually I know that some of these antiviral drugs, the ones that would use for a patient who already has it, those are already in testing, both in China and the United States. For the vaccines, it's going to take a little bit longer, and I think, and Dr. Fauci may have mentioned this himself, I don't think anyone expects that testing process is going to be finished before maybe the end of this year or sometime in 2021. So we'll see those antivirals, if they seem to be working, we'll see those deployed before we see a vaccine deployed.
All right, Dr. Joel Selanikio from Georgetown University Hospital, thank you.
Pleasure.